Low atrial fibrillary rate may indicate poor outcome in heart failure. A study by Platno PG and colleagues had evaluated the role of atrial fibrillary rate in predicting the outcome in mild to moderate heart failure. Atrial fibrillary rate is a measure of the atrial remodeling due to atrial fibrillation, which is both electrical and mechanical. Acceleration of atrial fibrillary rate has been associated with longer duration of arrhythmic episodes. Faster atrial fibrillary rates have been associated with poor outcome in electrical therapy of atrial fibrillation like cardioversion and catheter ablation of persistent atrial fibrillation in those without structural heart disease. The investigators analyzed high-resolution 20-minute Holter electrocardiograms from 169 patients with congestive heart failure. Estimation of atrial fibrillary rate was done using spatiotemporal QRST cancellation and time frequency analysis. Mean follow-up period was 44 months and total mortality was the primary endpoint. Sudden death and heart failure death were secondary endpoints. Authors concluded that a reduced atrial fibrillary rate was associated with higher risk of death due to the progression of heart failure and could be a predictor of poor outcome. Slower atrial fibrillary rate could indicate a combination of one or more of these factors. Reduced firing of focal atrial fibrillation sources, lower number of circulating wavelets, increase in atrial refractory period, slowing of atrial conduction. Example, age-related slowing of atrial conduction can lead to slower atrial fibrillary rates.